What's the best procedure for mid-facial rejuvenation?
People experiencing facial aging, particularly in the mid-face area, will often assume that they need some kind of a mid-face lift. However, what is seen as sagging or skin or tissue laxity may actually be more of a loss of projection and definition due to age-related volume loss. I'll discuss my experience and my approach to mid-face rejuvenation. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York and Long Island for over 25 years. As a cosmetic surgeon focused on treating facial aging, I perform all types of facelift surgeries, including mid-facelifts. The experience and knowledge of facial anatomy as a surgeon has guided my approach to the precise placement of cosmetic fillers at the deeper bone level to restore age-related bone volume loss. I recall how in the late 90s, facial aging in the mid-face was seen as a problem caused by laxity and vertical descent of the soft tissue in the mid-face. Different types of mid-face lift procedures were being developed using new endoscopic technologies. Mid-facelifts are not the same as traditional facelifts, which include smash facelifts, deep plane facelifts, or short scar mini facelifts. Full facelifts are meant to address sagging skin, soft tissue, as well as to tighten the underlying facial muscle foundation called the SMAS, which is an abbreviation for superficial musculoaponeurotic system. These different facelifts, which range with the extent of surgery appropriate for different age brackets, usually starting with an incision along the front of the ear and can extend behind the ear, so skin can be trimmed and lifted and the underlying muscle tissue is tightened and the soft tissue repositioned. The skin is redraped and the incision is closed along the incision lines. What's different with mid-facelifts that the lifting is limited to the mid-face and the incisions are usually made in the temple or from the eyelid area for surgical lifting of this limited space. In my opinion, having this experience, these mid-face lifting strategies address a small part of the more significant cause for a deflated and sagging appearance in this area. Volume loss is the main issue, in my opinion. This doesn't mean that there is no recognition of volume loss, as often surgeons will advocate combining a mid-facelift procedure with fat grafting in order to restore some volume. It's important to understand that as we age, bone, muscle, fat, and soft tissue decreases, with bone loss being the most significant. For example, cheekbone volume loss can make the skin over the cheeks appear to sag, as the volume that once gave the cheek skin some tension and structure and support has now diminished. Having performed mid-facelifts in the past, as well as the surgical placement of cheek implants to restore volume, I've evolved my approach to the mid-face by focusing on the bone loss and using new techniques to approach this particular problem. For most of my patients, I restore mid-face volume using a specialized method to place long-lasting hyaluronic acid fillers at the bone level in a way that's comparable to the placement of facial implants. Traditional filler placement at the mid-face is usually done at a more superficial level or within the soft tissue. At this level, the skin is unable to support any substantial filler volume. the filler material will oftentimes migrate, so you can look kind of soft and doughy and even bloated. With an understanding of the deeper anatomy of the face from performing facelift and other facial surgeries, I've been able to precisely place filler at the deeper bone level and avoid migration that is commonly seen when filler is placed in the soft tissue. Placing filler at the foundational bone level actually improves the definition of the facial bone structure. This method is called structural volumizing. At this time, my filler preferences are thicker hyaluronic acid fillers, such as Juvederm Ultra Plus and Juvederm Voluma. Hyaluronic acid is found naturally in the body, so these fillers are quite biocompatible and are safely metabolized with time. We perform structural volumizing for the mid-face routinely in our office. Many of our patients come in during their lunchtime and return to work right after. Your results can be appreciated immediately after the procedure. However, we allow for about 2 weeks to let the material settle into the space that it was placed into. I see my patients in 2 weeks and see if any enhancement could be of any benefit. Generally speaking, one of the first noticeable effects of aging occurs in the mid-face and is characterized by volume loss, leading to having less projection and definition. As opposed to surgery and fat grafting, the strategic placement of filler at the bone level can actually add structure, definition, as well as provide a subtle lifting effect without surgery. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.